We talk a lot in the media about threats and crises and emergencies, but there's no doubt that the coronavirus is all of that, with the potential to rapidly get much worse. Globally, coronavirus infections are edging up towards 100,000 persons, with deaths now approaching 3,000. It's also been detected in over 60 countries worldwide. Here in Australia, an elderly man lost his life over the weekend, our first death as a result of coronavirus. And today, with Iran reporting almost 1,000 cases and almost 60 deaths, the Morrison government has banned visitors from Iran who have not first spent 2 weeks in a third country other than China. Now, in economic terms, we saw further falls in the stock market today, and it's now down well over 10% over the week, with growing reports of people stocking up on food, face masks and basic medicines. As you know, last Thursday, the federal government announced it was implementing the National Pandemic Plan, even though the World Health Organisation has not yet declared this a pandemic. And today, the New South Wales government announced the establishment of special respiratory clinics for people with flu-like symptoms to avoid a potential spike in presentations to emergency departments. Now, with one of the world's best health systems, a generally healthy population and a government that's been planning for the potential pandemic over the past 15 years, Australia is as well placed as any country to weather this storm. And viruses of this type are inherently unpredictable. Unpredictable as to their incidence, their severity and the duration. They can disappear almost as suddenly as they emerged. They can come and go, and they can become much more virulent, as well as less severe, as they mutate. So anyone out there who says they know how this outbreak will play out is kidding themselves, as not even our best scientists yet know what's ahead. As the Deputy Chief Medical Officer said recently, we've had the very best modelers trying to predict what might happen. And it ranges from the virus not coming to Australia all the way to everyone getting it, and we're trying to prepare for all of those possibilities. As my Friday night guest, Professor Robert Boy of the National Centre for Immunisation Research and Surveillance put it, and I'll quote, "I think our containment approach, I think we can keep it down to well under 50% of the population getting sick." But he said, "That's still a lot. I'd like to see it down to 10% or 20% of people. This is a highly transmissible virus and it's really quite worrying." So let's take those numbers at the bottom end of the scale, Robert Boy's scale. If we say 10% of Australians were to catch coronavirus, that's still 2.5 million people. And with a 2% mortality rate, that's 50,000 dead. And almost certainly, those deaths, of course, will be among elderly Australians with other likely health issues. Still, if 2.5 million people presented to a public hospital, emergency departments across the country, that would be a 30% increase, 30% plus increase in terms of the load on our health system. And if half of them were admitted to hospital, that would be a 15% increase in our rate of hospitalisations. And then, of course, there's the economic consequences of any pandemic. Already our airlines, universities and the hospitality sector are feeling the squeeze. According to Access Economics, even if the global outbreak is contained by July, Australia's growth will be down 0.3%. $1.8 billion will be wiped off the budget, and the overall cost of the economy in 2020 will be almost $6 billion. That's assuming, of course, that coronavirus does not tip the whole world economy into a global recession, which the former Finance Department Secretary Jane Holton, she was also the Health Department head too, I might add, says it has the capacity to do. I stress that right now, all that is possible rather than certain, all of this is still very much up in the air. But with the likelihood of serious consequences becoming greater every day, we have to be far more ready than usual for difficult days ahead. The last time Australia and the world faced a global pandemic, death was hardly a stranger to us. Back in 1919, when 42% of all the deaths in Sydney were from the flu, and about 15,000 people died nationwide from the Spanish flu, from a then Australian population of 5 million, we were just emerging from the bloodiest war in history, and life expectancy at birth was under 60 years. Today our health is much better and our healthcare system itself very good, but our resilience, our human resilience in the face of trauma may not be. The interconnectedness of the world today, be it the physical movement of people in our age of rapid airline travel, or our financial interdependence in the age of global markets, demonstrates that a sneeze in one place can end up as pneumonia somewhere else. As I look at the federal government's handling of this crisis, knowing all the players as I do, the one thing we can all be thankful for is that Greg Hunt is the Health Minister, given his intellectual grunt and long experience at the cabinet level. Some of his other cabinet colleagues, well, I wouldn't even get them to man the photocopier in Hunt's office, so we could all be happy for small mercies there. But even with the quality of Greg Hunt's preparedness to date, I suspect we're likely still to be tested, really tested, in coming days and weeks in ways that just a few short months and years back, few of us would have imagined. One thing I know for certain, this will really sort out the keep calm and carry on sort of generations from all the rest.